Bonjour. Thank you very much to the organisers for inviting me to speak at this prestigious event. I was asked to tell you what we are doing in Britain against tobacco. Okay, got it. But before I do that, I want to tell you why tobacco use and smoking is very important in the fight against cancer. Smoking also causes a lot of other diseases like cardiovascular disease and respiratory diseases, but because today is focusing on cancer, I'm doing the same. Now, smoking is the largest single cause of cancer here in France and worldwide. Now, why is that? When you light a cigarette, the cigarette smoke contains over 4,000 different smoke constituents. People smoke for the nicotine, but it's not the nicotine that causes the harm. And 70 of those smoke constituents are known to cause cancer. And when you inhale the cigarette smoke and these carcinogens go into the lungs, and then they go through the blood and around the body and reach every organ in the body, and they damage the cells and cause cancer. And that's why smoking is known to cause 15 different cancers, many of which we've heard about this morning. And we're all the time finding new cancers which are caused by smoking. So there are probably many more to add to this. Now, I believe it's more important to prevent cancers than to treat them. And tobacco control is very cost-effective. It is very good for the economy because it saves money in the long run that is used to treat cancer. And it also saves businesses because people who smoke are more likely to take time off work. So overall, tobacco control is very good for the economy. So turning to the United Kingdom, on this graph you can see the green line in the middle is all adults, the blue line is men, and the red line is women. And you can see that smoking rates have been coming down since the mid-1970s. They plateaued a bit in the 1990s, which is why we needed to develop new measures, which I'm going to tell you about today. Now, with that very large survey, it takes a couple of years for us to get the data. So we also have another survey just in England, which is led by Professor Robert West, and that gives us data contemporaneously. And it's very important in the fight against tobacco to have information about what is happening now. And if you see on the right-hand side of that graph, those data are from 2014, January, so last month. And you can see that the rates of smoking have continued to decline, possibly more so in the last 6 months. Now, most of our attention is on adults, because if we can get adults to stop smoking, that will have a very significant impact on cancers in the next few decades. But what is happening with children? Well, in the UK, you can see that children smoking, not a lot happened in the 80s and 90s, but more recently, children's smoking has been going down, and it's now 4% of 11 to 15-year-olds only who are smoking. So the message there is if you want to reach children, it's very important to encourage adults to stop smoking, because that will have a knock-on effect on children. Children tend to copy adults, but also it denormalizes smoking in the population. So how have we done this in the UK? Well, we've implemented a comprehensive tobacco control strategy. And what do I mean by that? I mean that you need to have a number of measures and you need to implement them at the same time because they have a synergistic effect. The sum is more than the sum of the parts. And it needs to be enforced and it needs to be properly resourced. So there needs to be funds for tobacco control, although some of the measures I'll tell you about are free. And it also needs to be regularly updated. So these are the elements that are important in a comprehensive tobacco control strategy. First is the price of tobacco. The price of tobacco needs to increase every year. Now, that doesn't have a negative effect on the economy because although people will reduce their smoking, because the price has increased, the money coming into government remains about the same. But price is one of our main measures in the fight against tobacco. When you increase the price, cigarette consumption goes down. And that pattern is consistent, whatever country in the world we're talking about. It's a very consistent picture. Secondly, we need to have very high-profile advertisements on television, radio, about the dangers of smoking. People are aware that smoking is dangerous, but they just don't realize how dangerous it is. And it's very important to give these messages out regularly to the population. For example, you can use testimonial campaigns. Many smokers die in middle age, and we have some very strong campaigns of middle-aged people who are dying because of their smoking, who won't see their children grow up. And these can be very memorable and impactful. We also need to have smoke-free policies in workplaces and public places, and these need to be enforced. And to counter those measures, we also need to help smokers. This isn't just about beating smokers up. This is about offering support to smokers, because we know that smoking is very addictive. So smokers need help and support when they try to stop smoking. And then finally, we need to have a comprehensive ban on tobacco advertising. And by that I mean not just billboards or adverts in magazines or the press, but we need to get rid of other forms of tobacco promotion. This is one example. This was taken in a shop in England. This is in the prime place where everybody has to go to pay for their goods, and you can see the cigarette packs all arranged there, and you can see also they're very close to the sweets for young children, and eye-catching displays. And we need to replace those. This picture I took in Ireland, where they removed all of these displays of tobacco. This shopkeeper was very pleased because she found somewhere to hang her peanuts, but I'm sure there are other things that you can put on these places. Now, in England, we've removed these point-of-sale displays in supermarkets, but next year it will come in these smaller shops. I mentioned a number of things, but I'd also like to add that you do also need to prevent children from purchasing cigarettes. So the last one is about having a law to prevent children from buying cigarettes, and then you need prevention programs in schools. And this strategy has been written into 3 government documents in England in 1998, and then in 2010 and 2011. But you need to continuously update the strategy, as I've mentioned. So in England at the moment, we're considering plain packaging for cigarettes. So what do I mean by that? I mean that we remove promotion that is on the pack. I guess if I'd just shown you the red chevron, you would have all known that that was Marlboro. And if this was a room of 1,000 school children, God forbid, but if it was, then they would also recognize that as a Marlboro cigarette. And cigarette packets have become very much more fancy. So they're different colors, they're different shapes, they have gadgets attached to them, you can feel them. So the tobacco industry has spent a lot of money on using the pack to promote smoking. And so what we are interested in is removing all of that branding and just putting plain dark colors on the packs with very graphic health warnings. And Australia has done this, and we're learning from Australia, and we hope to do this in England soon. We also need to extend smoke-free places. So we're looking at extending that to cars and making it illegal for people to smoke in a car when children are present. And also prevent other people buying cigarettes for children. And finally, we're looking at harm reduction. Harm reduction is about making smoking less harmful for people who don't want to stop or who cannot stop. I mentioned at the start that nicotine is the addictive substance in smoking, but it's not what kills. Nicotine is thought to be relatively harmless, so it's a bit like caffeine. I wonder how many people here have had a coffee before they came into the auditorium. So is there a way of getting your nicotine in a form that doesn't kill? Now, we have nicotine replacement therapies, but the most interesting development is that of electronic cigarettes. This is just one type, but there are many, many different types of electronic cigarette. And what we found in England just recently is that this is the support that was used by smokers on their last quit attempt. And you can see the green line with the red circle. That shows that e-cigarettes were the most commonly used aid in stopping smoking in England in the last few months. There's a lot of controversy about electronic cigarettes, but they do deliver nicotine away from all of those other carcinogens in smoke. So I believe that they offer huge potential for combating the tobacco epidemic. I'm just going to mention a couple of other things. One is that you need proper funding and coordination of research. So we have a centre, a consortium of researchers in the UK. We've had that since 2008. I think a number of us have aged a bit since then. And we've also added now alcohol to our centre. So we work with one another. And the addition of New Zealand there is because we've co-opted Sally Caswell, who's an alcohol expert, into our team. But this is probably my most important slide. If you remember one slide from this talk, remember this one. The tobacco industry needs people to continue to smoke, and it needs children to take up smoking if it is to survive. So it's very important to not allow the tobacco industry to be involved in discussions about policy. And this is enshrined in the first and only WHO Public Health Treaty, the Framework Convention on Tobacco Control, which said that parties had to protect policies from the tobacco industry. And we have written that into our English government strategy. So we have to publish the details of any policy meetings which involve the tobacco industry and government departments. We also have to disclose any links or funding with the tobacco industry. And I believe that's very important. And unfortunately, it's not just the tobacco industry, but they pay other people to be involved in these meetings. And if you're interested in perhaps this debate and some of the other people involved, then please go to this website, which has more detail. We haven't won the war against smoking. We still have 1 in 5 adults who continue to smoke. But our main problem is around health inequalities. Approximately twice as many people in the more disadvantaged groups continue to smoke than in the higher income groups. So we still have a long way to go. Okay, so to conclude, I believe that reducing smoking will have the largest impact on reducing cancer over and above any other strategy, and there is evidence to back this up. Smoking in England has been steadily declining over recent years, and a comprehensive tobacco control strategy is required, which is regularly updated and refreshed and appropriately resourced. And the tobacco industry and related groups must not be allowed to influence policy. Thank you very much for your time.